Welcome to the Sleep to Dream Analytics Explainer video, where better sleep starts with better understanding. All right, let's dive into a really fascinating medical mystery, one that affects millions of people who often have no idea it's even happening. And it all starts with a pretty simple question. Have you ever woken up with a jaw that just aches, or maybe a dull headache you can't explain? You might blame it on a bad pillow or a weird sleeping position, but the real culprit? It could be something you're doing completely unconsciously while you're fast asleep. Well, that reason could be sleep bruxism, grinding your teeth at night. But as we're about to find out, getting a straight answer isn't as simple as it sounds. We're going to piece together the clues, one by one, to figure out why. So let's get into it. Let's start unpacking the evidence in this whole night grinding mystery. First things first, we need to know exactly what we're looking for. Okay, so here's the official definition. When we talk about sleep bruxism, or SB, we're not just talking about that classic grinding sound. It's any kind of repetitive jaw muscle activity while you're asleep. That includes silent clenching, bracing your jaw, or even thrusting it forward. This is so important because it's way broader than what most people picture. And right here, this is the heart of our mystery. There's no simple blood test, no quick scan that just gives you a yes or no answer. The biggest challenge is that there's just no single, easy, universally accepted way to diagnose it. So, to try and solve this, experts came up with a grading system. You can almost think of it like the levels of evidence in a court case. A possible diagnosis? That comes from witness testimony. Probable? That's when you find physical evidence. And a definite diagnosis? Well, that requires bringing in the forensics. In this case, some serious instrumental assessment. Let's break down each level. Okay, let's start with our first level of evidence, the witness report. This is where pretty much every investigation begins, with what the patient, or maybe the person sleeping next to them, has to say. So, a possible diagnosis is all based on reports. This could be you filling out a questionnaire, just talking with your doctor, or, and this is a big one, your partner or parent telling you they hear you grinding at night. It's a crucial first step, but it's got one major flaw. And here's that flaw. 80%. That's the estimated number of bruxism episodes that are completely silent. It's just clenching or bracing with no sound at all. That means you and anyone in the room could have absolutely no clue it's even happening. And this is exactly what happens when you put those self-reports to the test. Researchers found that when people who swore they were grinding were actually monitored in a sleep lab, less than half of them really met the official criteria. The witness testimony, on its own, just isn't reliable enough. So if we can't fully trust the witness, what's next? Well, we have to look for physical clues. And that brings us to level 2 of our investigation, where a clinician basically becomes a detective, searching the scene for hard evidence. A trained professional knows exactly what to look for. They'll spot things like unusual tooth wear, or maybe jaw muscles that are enlarged from being overworked. That's called masseter hypertrophy. They might even see little ridges inside your cheeks from biting. And yeah, fractured fillings or implants, that's another huge red flag. But even this kind of evidence can be a bit of a red herring. And here's why. Not all tooth wear is created equal. You have attrition, which is wear from tooth-on-tooth contact, a classic sign of grinding. But then you have erosion, which is caused by acid, say from acid reflux or even your diet. And to the untrained eye, they can look almost identical. A clinician has to know how to tell the difference. So when self-reports are shaky and the physical clues aren't quite enough, it's time to bring in the heavy machinery. We're moving to level 3, taking the case to the sleep lab for some definitive forensic level proof. So how do we get past possible and probable and finally land on a definite diagnosis? What does it really take to get that kind of conclusive slam dunk evidence? The answer is something called polysomnography, or PSG for short. This, right here, is the undisputed gold standard for diagnosing sleep bruxism. It's basically an overnight sleep study that measures everything that's going on while you're unconscious. And a PSG is unbelievably thorough. It uses special sensors to directly measure your jaw muscle activity. It looks at your brain waves, it monitors your heart rate and your breathing, and crucially, it includes audio and video recording so the experts can be sure they're not mistaking a simple yawn or someone talking in their sleep for a real bruxism event. But hey, even the gold standard isn't perfect for everybody. On the one hand, yes, it's the most accurate tool we've got. It gives you that definite diagnosis. But on the other hand, It's expensive, it's not available everywhere, and let's be real, trying to sleep in a strange lab covered in wires isn't exactly a normal night's sleep for anyone. Now, this is where our investigation gets even more complicated, because a good detective knows that a crime rarely happens in a vacuum. You have to consider other conditions that can either look a lot like sleep bruxism or are often found hanging around with it. For example, take something called orofacial dyskinesia. This also involves jaw movements during sleep, but it's a completely different animal. The movements are often described as more dance-like, and it's frequently a side effect of certain medications. This is exactly why getting the right diagnosis is so critical, because the treatment is totally different. What's more, sleep bruxism often has accomplices. It frequently shows up alongside other conditions. The big three you'll see are obstructive sleep apnea, OSA, GERD, which is that acid reflux we mentioned earlier, and REM behavior disorder. All of this just makes that diagnostic puzzle even tougher to solve. And that link with sleep apnea, it is particularly complex. Honestly, researchers are still trying to figure it out. Is it a chicken and egg thing? Does the pause in breathing trigger the grinding as a way to kind of jumpstart the airway? Or does the grinding somehow cause the breathing issue? Or could they just be two totally separate things happening at the same time? The truth is, we don't have a final answer yet, which makes diagnosis even trickier. Okay, so after looking at all the evidence, from the witness reports to the physical clues, all the way to the forensic analysis, what's our final verdict in this mystery? The biggest takeaway here is this: diagnosing sleep bruxism isn't a one-and-done thing. It is truly a process of building a case, piece by piece. You start with a possible story from a witness, you strengthen it with probable physical clues, and you finally confirm it with definite forensic evidence from the sleep lab. And all of that leaves us with one last really big question to think about. Given how complex this all is, how should we really be looking at sleep bruxism? Is it some disease that we need to find a cure for? Or is it more of a complex behavior, maybe even a protective one sometimes, that we just need to learn how to manage? The investigation, as they say, continues. Thank you for watching the Sleep to Dream Analytics Explainer video. We hope you sleep well and dream easy.